Certified Medication Aide Actual Exam Test Bank 1 Newest Complete Questions and Correct Detailed Answers. Question 1. A resident's MAR indicates to check blood pressure and hold medication if the systolic is below 120, and MA forgets to check the BP, administers the drug, and the resident loses consciousness. What is the direct cause of this error? Improper administration route. Failure to follow medication orders exactly. Wrong resident identification. Lack of pharmacological knowledge. Following the 5 rights includes observing specific parameters listed on the medication administration record, MAR. When an order includes a hold parameter, example, systolic BP 120, the MA is legally and ethically bound to perform that assessment first. Failing to do so can lead to dangerous outcomes, such as profound hypotension and loss of consciousness, which constitutes a serious medication error. Question 2. When using a medication cart in a facility, which of the following is an essential safety measure? Keep the cart unlocked for quick access. Store the key in the top drawer of the cart. The MA must keep the cart locked any time it is unattended. Only lock the cart at the end of the shift. Medication security is a primary responsibility of the medication aide. An unattended, unlocked cart is a major safety risk and a violation of facility protocol. Locking the cart prevents unauthorized access by residents, visitors, or other staff, thereby preventing potential medication errors, accidental ingestion, or theft, diversion. Question 3. What is the medication aide's role regarding a resident undergoing cancer treatment? MAS can prescribe chemotherapy drugs. MAS can adjust the dosage of radiation-related meds. MAS may administer drugs to help manage the side effects of chemotherapy. MAS are prohibited from caring for cancer patients. While medication aides do not administer the actual chemotherapy, which is typically done by specialized RNs, they play a vital role in supportive care. This includes administering prescribed medications for side effects such as nausea, antiemetics, pain, analgesics, or skin irritation, ensuring the resident remains as comfortable as possible during treatment. Question 4. How should a medication aide properly remove a tablet from a blister pack? He should peel the foil back with his fingernail. He should use a sterile needle to poke it out. He should press the tablet through the foil backing into a souffle cup. He should shake the pack until the tablet falls out. To maintain hygiene and ensure the correct dose is captured, the MA should pop the medication directly through the foil into a small medication cup, souffle cup. The MA should avoid touching the medication with their bare hands to prevent contamination and should never use sharp objects that could damage the tablet or the packaging. Question 5. A nurse asks an MA to give a subcutaneous insulin injection because the facility is short-staffed. Facility policy forbids MAs from giving injections. What should the MA do? Perform the injection this once to help the nurse. Tell the nurse they cannot perform the injection because it is outside their scope. Only give the injection if the nurse stays in the room. Ask the resident if it is okay for an MA to give the shot. A medication aide must never perform a task that is outside their legal scope of practice or prohibited by facility policy, regardless of staffing levels. Administering medications via an unapproved route, like an injection, puts the resident at risk and jeopardizes the MA's certification. The MA must politely but firmly decline and inform the supervisor. Question 6. Which class of drugs is used to shorten the length and reduce the severity of a shingles, herpes zoster, outbreak? Antifungals, antibiotics, antivirals, antihistamines. Shingles is caused by a virus, the varicella zoster virus. Therefore, antiviral medications, such as acyclovir or valacyclovir, are the standard treatment. These drugs are most effective when started within 72 hours of the rash appearing. They help the blisters heal faster and reduce the risk of long-term nerve pain, postherpetic neuralgia. Question 7. How should a resident's head be positioned during the administration of a nasal spray? Tilted far back, turned to the side, slightly forward, lying completely flat. When administering nasal spray, the resident should sit upright with the head tilted slightly forward. This position helps the medication stay in the nasal passages where it can be absorbed by the mucous membranes, rather than running down the back of the throat, which can cause an unpleasant taste and reduce the effectiveness of the dose. Question 8. Metformin, glucophage, and glipizide, glucotrol, are most commonly prescribed for which condition? Type 1 diabetes, type 2 diabetes, hypothyroidism, congestive heart failure. These are oral hypoglycemic agents. Metformin works by reducing the amount of sugar the liver produces and improving insulin sensitivity, while glipizide stimulates the pancreas to produce more insulin. They are primary treatments for type 2 diabetes, where the body still produces some insulin but cannot use it effectively. Question 9. Which of the following statements is true regarding anaphylaxis? It is a mild allergic reaction requiring only observation. It is a life-threatening emergency requiring immediate action. It only occurs in response to food allergies. It is treated with a standard dose of aspirin. Anaphylaxis is a severe, systemic allergic reaction that can cause the airway to swell shut and blood pressure to collapse, anaphylactic shock. It is a medical emergency. Common triggers include medications, bee stings, and certain foods. Treatment typically requires an immediate injection of epinephrine. Question 10. What is another professional title often used for a medication aide? Nursing assistant, medication technician, licensed practical nurse, pharmacy assistant. While titles vary by state and facility, medication technician or med tech is the most common alternative for a medication aide. Both roles involve a specific certification that allows the individual to administer certain medications under the supervision of a licensed nurse. Question 11. Which of the following describes the difference between laws and ethics in healthcare? Laws are suggestions, ethics are requirements. Ethics guide responsible behavior, laws enforce that behavior. Laws and ethics are exactly the same thing. Ethics only apply to doctors, while laws apply to aides. Ethics refer to the moral principles that guide a person to do what is right or responsible. Laws are formal rules established by the government that must be followed. They carry legal consequences if broken. In the MA role, ethical behavior ensures high-quality care, while following the law ensures the MA stays within their legal scope of practice. Question 12. What does the term controlled substance refer to in a medication setting? A medication that must be kept in the refrigerator. A medication that is only available in liquid form. A medication considered to have a high potential for abuse or addiction. A medication that can be bought without a prescription. Controlled substances, such as opioids or certain anti-anxiety meds, are regulated by the DEA because they carry a high risk of dependency and abuse. These medications require strict storage, often double-locked in a cart, careful counting every shift change, and precise documentation to prevent diversion or theft. Question 13. Which of the following tasks is a medication aide never allowed to perform? Administer an oral tablet. Apply a medicated patch. Receive medication orders from a doctor over the phone. Document a resident's refusal of a medication. Receiving a new medication order via telephone is a high-risk task that requires the clinical judgment and specialized training of a licensed practical nurse, LPN, or registered nurse, RN. The MA can only administer medications that have already been reviewed, transcribed, and entered into the MAR by a licensed professional. Question 14. In a healthcare setting, what is diversion? Changing a resident's treatment plan. Theft or unauthorized use of prescribed medications. A technique to distract a resident during a shot. Transferring a patient to another facility. Drug diversion occurs when a healthcare worker takes a resident's prescribed medication for their own use or to sell. This is illegal and constitutes resident neglect, as the resident is not receiving their required treatment. Diversion most commonly involves controlled substances like narcotics. Question 15. What is the medication aide's primary role in preventing drug diversion? Searching other staff members' bags. Practicing careful, accurate, and immediate documentation. Storing all medications in their personal locker. asking the resident to count their own pills. Accurate documentation is the first line of defense against diversion. By immediately recording exactly when and how much medication was given, and by participating in accurate shift change counts of controlled substances, the MA creates a clear paper trail that makes theft easier to detect and deter. Question 16. Which of the following is a clear example of negligence by a medication aide? Asking a nurse for help with a calculation. Leaving medications on a bedside table because the resident is asleep. Washing hands before and after administration. Reporting a medication error to the supervisor. Negligence is a failure to provide the expected standard of care. Meds must be observed being swallowed. Leaving them on a table is medication abandonment. The resident could take them at the wrong time, another resident could take them, or they could be lost, all of which put the resident in danger. Question 17. Which of the following medications are categorized as solids? Elixirs, syrups, and suspensions. Capsules, powders, and caplets. Creams, ointments, and lotions. Transdermal patches and gases. Solid medications come in various forms including tablets, capsules, gelatin shells, caplets, tablet shaped like a capsule, and powders. Understanding the physical form of the medication is important because it dictates how the drug should be prepared and administered. Question 18. Which statement is true regarding controlled release or time release medications? They should be crushed to help the resident swallow. They can be split in half if the dose is too high. They cannot be split, crushed, or chewed. They must be dissolved in hot water before administration. Controlled release, CR, extended release, ER/XR, and sustained release, SR, medications are designed to release the drug into the bloodstream slowly over many hours. If you crush or split them, the entire dose is released at once, dose dumping, which can lead to toxicity and leaves the resident without medication for the rest of the day. Question 19. How are medicated transdermal patches typically administered? By dissolving them under the tongue. By sticking them directly to the skin. By swallowing them with a full glass of water. By heating them before application. Transdermal patches deliver a steady stream of medication through the skin and into the bloodstream. When applying a new patch, the MA should wear gloves, remove the old patch, clean the skin, and choose a new, intact skin site to prevent irritation and ensure consistent absorption. Question 20. Which of the following is true concerning generic medications? They are always more expensive than brand names. The name is usually based on the medication's active ingredients. They have different active ingredients than brand name drugs. They are less safe than brand name medications. Generic names, like acetaminophen, are the official, non-proprietary names for the active chemicals in a drug. They are required by the FDA to have the same active ingredients, strength, and dosage form as the brand name equivalent, like Tylenol. Generics are usually more affordable because the manufacturer did not have to pay for the original research and marketing. Question 21. What is the otic route of medication administration? Administration via the eye. Administration via the nose. Administration via the ear. Administration under the tongue. Otic medications are ear drops. When administering to an adult, the MA should pull the earlobe up and back to straighten the ear canal. For a child, the earlobe is pulled down and back. This ensures the drops reach the eardrum for maximum effectiveness. Question 22. How might a resident's gender affect how a medication works in their body? Gender has no impact on medication absorption. Medication generally remains in a woman's body for a longer period of time. Men always require higher doses than women. Women absorb oral medications faster than men. Due to differences in body composition, hormone levels, and the ratio of fat to muscle, many medications are metabolized differently between men and women. On average, women have a higher percentage of body fat and different enzyme activity, which can cause certain drugs to stay in the system longer.